Texas Infusion Hotline, how may I help you?
Hi there. Is it true that you can't get it, the infusion if you're white? Oh my God. What's up, guys? Nuance Bro checking in, and today we're going to be talking about a story of potential racial discrimination when it comes to monoclonal antibody treatments. Let's get into it. So this all started from a tweet from Harrison Hill Smith. He is the host of American Journal on InfoWars. And you can see the tweet here. Literally just got denied medical service for being white. Monoclonal antibody treatments only available for blacks and Hispanics. Insane. So you're not just going to take someone's word for it always necessarily, but he accompanied this with video. Let's take a look.
So I'm not going to be able to get it today? Because I don't qualify?
Yep.
What if I like smoke and vape? I heard that was No? Okay. But if I were black and Hispanic, then I'd be able to qualify? Okay. I'm being denied medical service because of my race, is that?
That's the criteria.
Yeah.
So what I do, I go around and make sure everyone meet the criteria.
Okay.
So yeah, that's the criteria that was set forth. If you were 65, you'll be good. But nope, you're healthy. And you're healthy and no medical conditions. So research showed that you should be able to fight off COVID. Maybe it's for someone else, may preclude them a little more, or make them a little more susceptible to being worse with COVID.
So there you can see he's saying, I'm being denied medical service because of my race. And she says, that's the criteria. Now, it was kind of weird because she was recognizing that as the criteria in her response to his question about being denied medical service because of his race. But then she started listing things that weren't related to race. Like, you know, if you were over 65, if you had, you know, these other sort of medical conditions, whatever. But that's obviously untied from race. So the question would be, if he was a young, healthy black male, would he be able to get the treatment as opposed to being a young, healthy white male? So I was curious about this, and I decided to call the Infusion hotline, and I didn't get really far.
Texas Infusion Hotline, how can I help you?
Hi there. I'm just wondering, is race a factor when you guys give out the monoclonal antibodies?
Sir, you can find all of the CDC guidelines online. This is a hotline strictly used to schedule appointments. Do you need help scheduling an appointment?
I just need to know the rules for that, because I had a friend who went in recently and he was denied because he was white, I think. Is that something you guys do?
Sir, that would be something between him and his doctor.
Okay, but just generally, like as far as the guidelines are involved, is that something that's done?
You can look at the guidelines online.
You guys won't tell me?
Sir, you can look up those guidelines for yourself.
You won't tell me?
Sir, you can look up the guidelines for yourself.
Good evening. Thank you for calling the Texas Infusion Hotline. How may I help you?
Hi, am I able to check for eligibility through this?
I'm kind of confused. What you mean?
I mean, is everybody eligible to get the infusion if they're COVID positive?
If you tested positive, yes, of course.
Oh, because I had a friend who went there recently, and he said he was denied because he was white, and I think I saw it on video that the doctor said that as well.
Sir, would you like to schedule an appointment? It's 6 o'clock in the evening.
I just need to know if this is...
Would you like to schedule an appointment? If you don't
is this true or is this false? I just want to confirm this.
I can refer you to the CDC guideline.
Are you guys not answering this anymore? Is this something that came down from up above?
You can receive the information from the CDC website or the Health and Human Services
I didn't
website.
see it on the CDC website. That's why I'm asking you guys, is that a policy? Is there a way I can get an answer on this?
Your information as far as eligibility concerning, you can go onto the CDC website and seek your answers there, or if you have a primary care physician, you can consult with him.
Texas Infusion Hotline, how can I help you?
Hi, I'm on the CDC website reading the guidelines, trying to understand if I would qualify. Is this somewhere where I could get clarification on that?
Let me put you on hold.
Thank you. But is there a way I could figure it out through you guys? Because one of the things I heard was because I had a friend who went to an infusion center and he was denied because they said because he was white. Is that a thing?
That's between him and whatever happened there. I don't know.
So you don't know if that's a criteria or not?
Sir, again, the criteria is the federal guidelines that we follow. This hotline is strictly used to schedule appointments.
I know, but like you don't know if that's a thing or not. Now, that's just a sample of some of my calls. I'm not going to get into the entire length of the calls and some of the different calls that I had to do. But I promised that wasn't just a total waste of time and it had nothing to do with the point because, this is primarily, so they say, a hotline to schedule appointments, not necessarily to get information. But I did see a video from Dave Riley who did call them and he kind of got an answer. Let's take a look.
Texas Infusion Hotline, this is Dominique. How can I help you?
Hi, Dominique. I'm just calling. Is it true that you're not giving monoclonal antibody infusions to white people?
No, that's not true at all.
Right. So a friend of mine was down there trying to get a monoclonal antibody infusion, and he was refused because he was not Hispanic or African American. They told him that they were only serving...
Okay, so there's eligibility criterias that we go by, and African American and Hispanic are high-risk ethnicity groups, so that would be a qualifier. But that doesn't mean that we don't give it to white people. So we're prioritizing more vulnerable populations, so people who have an underlying medical condition, anyone who has an underlying medical condition can get it. But along with that, people with a BMI of 25 or higher, people who are 65 years of age or up, or high-risk ethnicity groups can get it.
So if you are a healthy, in-shape Caucasian and you show up, you are not going to get an infusion?
Based on the criteria that we go by right now, that is correct.
That's it. Thank you.
So there you can see the operator confirm this as a real thing, that there is eligibility criteria and it is based on race. Although this isn't to exclude everyone who isn't black or Hispanic. Obviously, once again, if you're, elderly or you have these pre-existing conditions, et cetera, you can still get the treatment. Although if you compare two very similarly situated, young, healthy people, but one is black and one is white, or one is Hispanic and one is white, the white person in this scenario doesn't get it, but the black and Hispanic people do, according to what was said on this call. And this is what it appears to be the case. When we bring that video together with the call and the information we know, that's what seems to be going on. Now, if you saw on one of the calls that I had, the lady told me, well, just look it up with the CDC, look up the criteria with the CDC. And I went on the CDC website and I wasn't exactly able to find exactly what she was talking about. She didn't give me like a website or anything like that. But because this situation happened in Texas, I decided to check with the Texas State Department of Health, which we can see right here. And we see what is monoclonal antibody therapy. We see who qualifies for monoclonal antibody therapy. And we see this hyperlink here that says, how do I know if I'm high risk and what do I do next? And if you click that, you'll eventually get to this page right here. And it says, who is at high risk for serious, what? And we go down here where we see individuals 12 or older may qualify for a monoclonal antibody treatment if they have certain age-based risk factors. So we see different ages here. We see different conditions, pre-existing conditions, etc. But nowhere here is race listed. And again, this is the federal government's, this is Health and Human Services website, hhs.gov, and there is nothing about race listed here. So in addition to that hotline that I called, it wasn't the only number I called, of course. I called the CDC, I called the Texas Department of State Health Services, and I contacted the governor's office of the state of Texas, Greg Abbott. I, of course, also emailed all of these offices, and I didn't hear back from any of them except for Governor Greg Abbott's office. And they just referred me to the Texas Department of State Health Services, which I already contacted, like I told you, and they haven't gotten back to me. Which is weird because I think the governor of Texas would be interested if his citizens were being discriminated racially when it came to monoclonal antibody treatments. So I did a little bit more digging and I found some documents that actually had some of the racial language in there. We can see here from the Oregon Health Authority in a document published August 26, 2021, where they talk about monoclonal antibody coverage. And here's some of the eligibility factors: age, obesity, diabetes, blah, blah, blah. But you look at this entire list here and you don't really see race or anything like that listed here. But once you read the paragraph below, there you see it. Other factors can be associated with increased risk for progression to severe COVID-19, including race and ethnicity. For example, data show that patients of color or from tribal communities are most harmed by health inequities, and the risk of hospitalization and death for these groups are greater than those of white patients. These patients may face higher risk than white patients due to long-standing societal injustices such as racism, discrimination, and colonization, which have and continue to negatively impact health outcomes. So they go as far as to blame colonization on negative health outcomes. I would love to see the studies that link colonization and COVID-19 outcomes. I don't know how many studies have been done on that and how they establish a causal link, but I don't know. I'm a bit skeptical, to be honest. The next document that I have is from MacArthur Medical Center. This is for North Texas OBGYNs and what they need to know for monoclonal antibodies. And if we scroll down, we can see who qualifies for monoclonal antibody therapy. And one of the things we see here is that high-risk ethnicity groups category. And it does say Latinx or Black. Glad they're using the woke language here, the Latinx. You know, I have a video on that, which if you haven't seen it, be sure to check that out. Here's another one from the Minnesota Department of Health. Suggested criteria for the use of monoclonal antibody therapy for, you know what, in children. So this isn't adults, this is children. And if we scroll down, we can see under race and ethnicity, Black/African American, Hispanic/Latino, Asian, Native Hawaiian or Pacific Islander, American Indian or Alaska Native. Basically every race/ethnicity except for white. Isn't that amazing? Here's one that doesn't have anything, for example, on race. Houston Methodist, leading medicine. What is monoclonal antibody therapy and who is eligible to receive it? And when you go to the criteria, you don't see anything here about race or ethnicity or anything like that. So they have all these things that we saw in the previous documents, but except it's without the race and ethnicity portion. So why the difference there? I don't know the answer to that, but I would like to know. And if they could respond to my emails or my calls, that would be fantastic. But they never answer the questions. But here's one of the questions we need to ask. Are there actual differing rates between races that would justify, potentially, some of these treatments based on race, or at least this sort of rationing of the monoclonal antibody treatment based on race? Well, let's take a look at the data. Here we can see from the Kaiser Family Foundation, they have some stats here. And here we can see risk of infection, hospitalization, and death compared to white people in the United States, adjusted for age. And we can see on the hospitalization front, Asians and whites are basically the same. But Blacks and Hispanics are at about 2.8 to the 1. When it comes to the deaths, whites and Asians, once again, are the same. But you see Blacks and Hispanics are at about double that of whites and Asians. And again, this is just adjusted for age. This is not taking into account different sort of comorbidities like obesity or diabetes and things like that. We can see here from the You Know What Tracking Project, nationwide, Black people have died at 1.4 times the rate of white people. This is per 100,000. So whites are at 124 per 100,000. And this is by race or ethnicity through March 7th, 2021. And Black or African Americans are at 178. But again, these disparities do not necessarily denote any sort of genetic difference when it comes to COVID, nor is it necessarily because of racism or discrimination. This could be a lot of factors. And again, this one is not adjusted by age. Here we have data from the CDC, disparities in, you know what, associated hospitalizations. And if we scroll down, we have age-adjusted, laboratory-confirmed, associated hospitalizations, rates by race and ethnicity from March 1st, 2020 through October 30th, 2021. And we actually see non-Hispanic, Asian, or Pacific Islander, so this is basically Asians, they are lower than non-Hispanic whites, basically whites. So they have a lower hospitalization rate. Yet on that Oregon document, we saw that they were listed as the high-risk ethnicities, or the ethnicities that would qualify for the monoclonal antibody treatment compared to whites. So if they're at the same or lower risk when it comes to hospitalizations, why would you include Asians in that list of race and ethnicities, but exclude pretty much only whites from that list? I think we know why. It's a social agenda. It stems from this woke ideology that is often anti-white in nature. And they kind of gave away the game when they talked about colonization and things like that. Those are code words when they talk, health outcomes from colonization with respect to COVID-19. You know what? Come on. And because we had that document dealing with children, let's take a look at their ages, 0 through 17, and we'll compare Asians with whites. We see their rate of hospitalization is the same even in children, but it is significantly higher for blacks and Latinos. And again, that's on average based on race, but that doesn't mean race is a causal factor. It could be higher rates of obesity. It could be rates of other comorbidities. Now, I did find some studies that take into account race and comorbidities and socioeconomic conditions and things like that and try to control for that. And this is what it says. So this is a study, September 25th, 2020. So it's kind of old. And in the design, setting, and participants, you can see this was a cohort study of 5,902 patients. It was at a large urban academic medical center in the Bronx, New York, between March 14th and April 15th, 2020. And you can see here in the results that Hispanic and non-Hispanic Black patients had a higher proportion of more than 2 medical comorbidities at 34.3% and 39.5% respectively, compared with 28.9% among non-Hispanic white patients. They were also more likely to test positive than white patients. And at the end here, it says, while controlling for age, sex, socioeconomic status, and comorbidities, patients identifying as Hispanic or non-Hispanic Black had slightly improved survival compared with non-Hispanic white patients. So it appears the eligibility criteria shouldn't be based on race. It should be based on these other factors that were listed, and basing it on race is just discriminatory. Now, one thing you didn't see in those documents or those protocols, those guidelines, that eligibility criteria, if this is truly criteria that's based on higher risk categories, while you saw race, you didn't see gender. Yes, being male puts you at higher risk of dying from you-know-what. As you can see here from Brookings, at least 65,000 more men than women have died from you-know-what in the US. Men are much more likely to die from you-know-what than women. This is true globally, where the death rate has been about 50% higher for men. 50% higher. The gender gap is even wider when differences in the male and female age distributions are taken into account, since there are many more older women than men in the population, and age is the biggest risk factor in COVID deaths. As you can see in this graph, for example, almost twice as many men than women have died of COVID-19 in the middle age bracket. This is despite there being more female cases than male cases when it comes to COVID. So if being male is such a bigger factor when it comes to your risk of serious complications or even death from you-know-what, then why isn't that included in the eligibility criteria? It makes you think. So it also comes down to the question of, is this even legal? Because as you might know, they were trying to do this with the vaccine as well. The latest manifestation of this is Vermont's decision to allocate the availability of vaccine booster shots based on race. And they say they're largely following CDC guidelines, blah, blah, blah. However, in Vermont, if you are Black, Indigenous, or a person of color, BIPOC, or live with someone who is BIPOC, then you are eligible regardless of your age, your underlying health, or your employment. And in this article, they talk about how that makes no sense and how this is terrible policy. But you're seeing this more and more. They are using race as a discrimination factor when it comes to the administration of healthcare. And you got to ask yourself, is this legal? Well, the answer appears to be no. As you can see here from HHS, Health and Human Services, discrimination on the basis of race, color, or national origin. Title VI protects people of every race, color, or national origin from discrimination in programs and activities that receive federal financial assistance from HHS. Section 1557 of the Affordable Care Act, ACA, also prohibits discrimination on the ground of race, color, or national origin under any health program or activity, any part of which is receiving federal financial assistance, or under any program or activity that is administered by an executive agency or any entity established under Title I of ACA. A recipient of federal financial assistance may not, based on race, color, or national origin, deny services or other benefits provided as a part of health or human service programs, provide a different service or other benefit, or provide services or benefits in a different manner from those provided to others under the program, segregate or separately treat individuals in any matter related to the receipt of any service or other benefit, utilize criteria or methods of administration which subject individuals to discrimination, select a facility's site or location that excludes individuals or denies them benefits, deny an individual an opportunity to participate on a planning or advisory board. So it would seem under the law that this is pretty explicitly illegal, but they're doing it anyway. So again, my question is, as I posed it in those emails and as I posed it on phone calls, why are you doing this if it's illegal? Is this happening? In fact, is this part of your policy to discriminate based on race? Are those documents that I read, am I misinterpreting those? Is the video footage that I looked at and people's experiences that they're reporting, is that nonsense? Is what Vermont's doing with the vaccine, is that made up too? Or is there a real explanation behind this? Or are you just deciding to violate the law? I don't know. Let me know what you guys think. I think it's interesting. Have any of you guys experienced anything like this? Let me know in the comments down below. It's pretty crazy. But yeah, that's the end of the video, guys. I hope you enjoyed it. Don't forget to like, comment, and subscribe. Social media links are in the description box below, as well as merch. Support us at nuancebro.com/join. It really does help out the channel, and I appreciate it a lot. And I'll see you next time, bro.